All right, so today on Study Hall, we're diving into some pretty intense territory.
Yeah.
The U.S. officially withdrawing from the World Health Organization.
Right.
We've got a couple of key documents to guide us.
Okay.
We've got the executive order itself, signed just a few days ago, January 20th, 2025.
Mm-hmm.
And then we've got this separate analysis that tries to unpack the potential pros and cons, you know.
For like the average person.
Exactly. For everyday people like you and me.
Yeah, because this is gonna affect us.
Oh, absolutely.
Yeah.
So let's jump right in.
Okay.
The executive order. It's pretty blunt.
Yeah, it's striking how straightforward it is.
Yeah.
No mincing words. It just lays out all the administration's problems with the WHO.
Yeah. And they even use some pretty loaded language.
Oh, yeah, mishandling.
Right. Inappropriate political influence.
Yeah, strong stuff.
It definitely sets a firm tone. And they're really doubling down on this decision.
Oh, yeah, for sure.
Because remember back in 2021, there was that letter that tried to walk back the initial withdrawal notice.
Right.
But this executive order, it revokes that letter.
Wow.
So they're like, no, we're committed to this.
This is it. We're done.
This is happening. So let's get into the why.
Okay.
The executive order puts a lot of emphasis on the financial side of things.
Yeah, it zeroes in on the difference between what the U.S. gives to the WHO compared to China.
And they throw out some pretty stark numbers.
Oh, yeah. They point out that China's population is 3 times bigger than the U.S.,
Right.
but they contribute almost 90% less to the WHO.
So basically, it's like the U.S. is picking up the tab while others aren't really chipping in.
Yeah, I mean, think about it like, going out to dinner with friends.
Right.
And you're the only one who orders the lobster. Everyone else is getting salads, and then you get stuck with the giant bill at the end.
Right.
I mean, obviously, it's more complicated than that.
Yeah, it's a simplified analogy.
But you get the idea.
I get the idea.
The U.S. feels like they're shouldering too much of the burden.
And that ties directly into what the analysis document calls out financial reallocation.
Right. The idea is that if the U.S. pulls out of the WHO,
Yeah.
that money could be used somewhere else.
Redirected to different priorities.
Exactly. And it's not just about saving money, it's about control.
Right. Having a say in where that money goes.
Exactly. Maybe boosting domestic health programs, or maybe finding new global health partnerships where the U.S. has a bigger voice.
So there's this underlying desire for more autonomy.
Yeah.
When it comes to global health decisions.
Yeah, for sure. It's not just about the money itself, it's about the strings that might be attached.
That makes sense. And the analysis document labels this reduced political influence.
Right.
This idea that being a member of the WHO could actually limit the U.S.'s ability to act independently on global health issues.
Yeah, they want more freedom to make their own choices.
Okay, so now let's flip the script a little bit.
Okay.
One of the arguments in favor of this withdrawal is this whole concept of domestic health security.
Okay.
And to back that up, the executive order calls for the creation of brand new directorates within the National Security Council. Their goal, to safeguard public health and fortify biosecurity.
Those are their words.
Direct quote. So the question is this really about making the U.S. health system stronger?
Or is it a step towards isolationism?
Like a returning inward?
Right.
Yeah.
Exactly. And that's a huge question that the analysis document tries to grapple with.
Because on the surface, strengthening domestic health infrastructure sounds like a good thing.
Yeah, who wouldn't want that?
Right. But can any country, even one as powerful as the U.S., really tackle global health threats all on its own?
Yeah. It's like that old saying, no man is an island.
Right.
It applies to countries, too. We're all connected.
And that's where the analysis really gets into the potential downsides of this decision.
Oh, yeah. The what ifs.
Exactly.
Yeah.
And one of the big ones is this idea of weakened global health influence.
Okay.
The concern is that by stepping away from the WHO, the U.S. risks losing its leadership role.
In shaping global health policies and responses.
Exactly. It's like, imagine you've got a team working on a huge project.
Yeah.
And then one member suddenly decides to go solo. They might have their reasons,
Right.
but it's going to disrupt the whole team dynamic.
Totally. And it could even derail the entire project.
Right. And some experts are worried that's what's going to happen here.
It's a valid concern.
Makes you wonder what happens to all those global health initiatives that the U.S. has historically supported through the WHO.
Right. All those programs.
Things like vaccination campaigns in developing countries.
Disease surveillance.
All that stuff. The analysis document uses the phrase, disruption to global health initiatives.
Yeah, that sums it up perfectly.
And then there's the human element, too.
The people on the ground.
Right. The U.S. has personnel embedded within the WHO.
Experts who are working on these global health challenges day in and day out.
So pulling them back doesn't just sever ties.
It's a loss of expertise.
and a loss of those crucial networks that have been built over time.
Right. It's like losing key players from your team right when you need them the most.
And it could weaken the world's ability to respond to pandemics and other health emergencies. So if the U.S. is stepping away from the WHO, what's the plan B?
Yeah, what's next?
Well, the executive order instructs the government to find other partners, credible and transparent partners,
Okay.
to essentially pick up where the WHO left off.
To fill that void.
Right. But the analysis document kind of throws some cold water on that idea. They talk about the challenge of finding uncertain alternatives.
Because the WHO has this massive global reach and infrastructure.
It's not easy to replicate that.
It's not like just swapping out one teacher for another.
Right. It's like you're trying to build a whole new system from scratch.
And there's no guarantee it's going to be as effective.
And then on top of all of that, there's the potential fallout within the U.S. itself.
Right, what's happening back home.
Exactly. The analysis document points out that public opinion is divided on this.
Makes sense. There are strong feelings on both sides.
You've got people who are applauding this move.
Seeing it as a way for the U.S. to regain control.
Right. Over its resources and prioritize domestic needs.
America first.
But then you've also got folks who are really worried.
Deeply concerned.
They're concerned that this withdrawal will actually make the world less safe.
How so?
Because it's prioritizing short-term gains over long-term global health security.
I see.
It's a trade-off. And honestly, it's a really tangled web.
Yeah, with no easy answers.
And the full impact of this decision, it remains to be seen.
It's going to take time to really understand the consequences.
But one thing's for sure, it throws a wrench into the whole idea of global cooperation.
Especially when you're dealing with something like a pandemic.
Which, as we've all learned,
The hard way.
it doesn't respect borders.
Yeah, it really makes you think, about how we tackle these massive global challenges.
Right.
It's like this constant push and pull
Yeah.
between looking out for yourself and then working together for the greater good.
And we're seeing this trend of questioning international institutions
Oh, yeah.
pop up all over the place.
It's not just a U.S. thing.
Not at all. It's
Yeah.
like people are reevaluating the rules of the game,
Mm.
wondering if the systems we've been relying on are actually working.
Right. Are they still effective?
And when it comes to global health, the stakes are incredibly high.
I mean, we're talking about issues that could impact millions, even billions of lives.
So where do we go from here?
Yeah, what's the next chapter?
What does this all mean for the future of global health cooperation?
That's the million-dollar question.
I mean, the executive order says the U.S. will look for new partnerships.
Right.
But as we've discussed, actually replacing what the WHO does, that's a massive undertaking.
Yeah, it's a huge task.
So many unknowns.
A lot of uncertainty.
It's like venturing into uncharted territory.
Totally.
And while the U.S. is figuring out its next move, the WHO is still up and running.
Right, they're still operating.
So how do you think they'll adapt to the situation?
Well, one possibility is that other countries might step up.
To fill the void left by the U.S.?
Yeah, both financially and maybe even in terms of leadership.
So it could create a power shift within the organization?
Potentially, yeah. It's like a changing of the guard.
With new players stepping into more prominent roles.
Exactly. And you have to wonder if the WHO might use this as a chance to kind of, address some of the criticisms that have been leveled against them.
Like maybe this could be a catalyst for internal reform.
Right. Maybe they'll look at ways to increase transparency or improve accountability.
Revamp their financial structure.
Yeah, make some changes.
So in a way, this whole situation could end up being a wake-up call.
Mm-hmm.
Not just for the WHO, but for the entire global health community.
A chance to hit the reset button.
It forces us to really confront those tough questions.
And rethink our approaches.
Yeah, make sure we're actually equipped
Yeah.
to handle the health challenges of a world that's so interconnected.
Because we can't afford to be complacent.
That's such a crucial point. And it brings us back to why we're having this conversation today.
Right.
It's not just about dissecting this specific decision by the U.S.
It's bigger than that.
It's about grappling with the bigger picture.
The future of global cooperation.
The balance between national interests and global solidarity. Yeah. And ultimately how we ensure the health and well-being of people all around the world.
It's a complex issue.
With no easy answers.
Definitely not.
And that's why it's so important to talk about
To
it.
have these conversations.
Now, before we go any further, I want to turn it over to you, our listeners.
Yeah, we want to hear from you.
What are your thoughts on all of this?
What aspects of this situation stand out to you the most?
What questions are you wrestling with?
Because at the end of the day, this isn't just about policy or politics.
It's about people.
It's about human lives.
It's easy to get lost in the abstract debates.
the jargon.
But we can't lose sight of the human element.
The real people whose lives are directly impacted by these decisions.
Exactly. Whether it's a pandemic
Or a chronic disease.
or simply a lack of access to basic health care.
These are challenges that affect individuals, families, entire communities.
And those individuals, those families, those communities,
We're all over the world.
we're interconnected in ways we're only beginning to understand,
What happens in one part of the world?
can ripple out and affect everyone,
We're all in this together,
even if our approaches to solving global health challenges might differ.
right?
So how do we bridge those differences?
How do we find common ground?
As we move forward, it's so important to keep asking ourselves,
What can we do?
how do we create a global health system that is truly equitable,
Accessible.
responsive to the needs of all people?
It's a big question,
A challenging question.
but it's one we can't ignore.
And it goes beyond politics and economics.
It's about something deeper.
It's about our shared humanity. It really is a powerful thought, and it's a good place to start wrapping up our deep dive on the U.S. withdrawal from the WHO.
Yeah,
I mean, we've covered a lot of ground today.
we have.
The reasons behind the decision,
The potential upsides,
and of course, those very real risks that are hanging out there.
the unknowns.
This choice by the U.S., it's going to have ripple effects across the global health landscape for years to come.
Absolutely. And it's not just something happening, over there.
Right? It's not some far-off event.
This decision, it could affect your health, your community.
It's both local and global at the same time.
Exactly.
So as you're processing all of this information, we want to encourage you to go beyond just, forming an opinion.
Right.
Ask yourself, what role can you play
Yeah.
in shaping a future where global health is truly prioritized, where collaboration wins out over isolation?
A future where everyone has a chance to thrive.
It's a question worth thinking about. And we hope it sparks more conversations
More critical thinking.
and a renewed commitment to creating a healthier, more equitable world for everyone.
That's the goal.
Thanks for joining us on Study Hall today.
Yeah. Thanks for listening, everybody.
Until next time, stay curious, stay informed, and stay engaged.